Sound is such an intrinsic part of our life that our brain has a little editor to tune it out. When you walk down the street, you really don't pay attention to all the traffic and noise and everybody talking, unless it went silent and you're in the city. Then you're going to notice it. You really don't notice all that hustle and bustle all the time. When someone comes to us, I really don't ask them what they have. I know what process I need to do to get the information out of them. I need to ask them for a sample of their voice.
I was a lawyer, an engineer, and I grew up in southeastern Ohio, and I lived in Florida for 30 years where I practiced maritime law. Well, when I had the motorcycle accident, I had just bought my 30-something motorcycle and didn't even get home with it. A truck had pulled in front of me, and I was in the hospital for a long time. My leg was almost completely cut off. This was all gone, totally just gone, and only this back here was left. All this is muscles taken out of my back and skin taken off of my hip and my butt. All this is skin grafts. And this was like jelly when I first met Sharry. You could hit this and like waves would go through it. So the doctors were telling me probably the best recovery I would ever have would be at least walking on a cane would be the best I get, and maybe even arm braces or crutches for the rest of my life. They told me that tennis was out of the question, that I wouldn't be playing tennis. So, and now I am back playing tennis on a regular basis and teaching tennis again.
Sound Health is a company that I started, and it's sort of a play on words. It's Sound Health as in sound, integral, stable, foundational health, and Sound Health in that we use sound and frequency to help people live their optimal lives. Let's go.
Today is Thursday, April 14th. It's a beautiful sunny day outside. It's about 70 degrees, and this...
What we do at Sound Health is called Human BioAcoustics, and it has two parts. One is vocal profiling. That's when we set you in front of the mic and take your print. After we do someone's vocal print and crunch it in the computer, is to give them back frequencies that artificially entrain their brainwaves. And you can hook someone up and look at a muscle, and that muscle frequency is not what it ought to be, and give them a sound through headphones or just through a speaker, and that muscle will change. Everybody's already familiar with this idea of bioacoustics and vocal analysis. They just don't know they are. When you consider that a young male goes through puberty and his biochemistry changes and his voice changes, well, that's a given. People know that, but they haven't ever been able to look at it in a scientific way, and that's what we're doing. We're taking a very esoteric idea that our body is an instrument and it needs tuned occasionally.
Something is redone in my brain, or I couldn't hear any of this because I never did before.
Say the word not.
Not.
Say the word me.
Me.
Say the word it.
And 18 years later, you know, I mean, it wasn't, they were terribly pessimistic with me from the get-go.
Most comfortable today was 50 dB. Just to remind you, 50 to 55 is normal conversational level, so that just fits with, that's a very normal hearing ear. Your speech threshold is 15 within the normal range for the left ear, and you understood all of the special word list.
I enjoyed good health until the summer of 2001, and then problems occurred where I started developing numbness and weakness in my feet and my legs. And it was determined I had something called a syrinx of the spinal cord. This is like an internal cyst. I had a procedure where they went through 3 vertebrae in my back, incised my spinal cord, drained this fluid, and unfortunately it was a markedly downhill spiral for me. where I went from walking to a limp, then a wheeled walker, and finally practicing emergency medicine out of a scooter for over a year. I went and sought many opinions on this. I went to Ohio State, the Cleveland Clinic, and Mayo Clinic. Different treatments were recommended. I took multiple sclerosis drugs such as Copaxone for daily injections. I was given high-dose intravenous steroids for treatment. And at one point it was recommended to me for me to take a drug called Novantrone, which is a chemotherapy. The opinion of the Mayo Clinic was I had a progressive neurologic disorder. They did not really see much in the way of treatment or hope. But then amazing things started happening to me after I sought other treatment. Acupuncture and hypnosis, but then I believe the main therapy which has helped me the most has been bioacoustics and sound therapy. I've no longer used a scooter at work, and I haven't used my scooter in over a year. I moved back to the wheeled walker, went from there back to a quad cane, and over the last 4 months have improved now to just a straight cane. At one point I had an EMG done at the baseline which showed degeneration of my nerves. I had a repeat EMG done approximately 2 weeks ago that showed that the nerves to my quadriceps had completely degenerated. The nerves to my tibialis anterior, which is the muscle in front of the leg, below the knee, completely regenerated, and the muscles in my calf regenerating, being denervation 3 to 1. Well, this is something that we don't expect nerve injuries to heal. I usually have a reassessment done every 4 to 6 weeks, find out what I'm deficient in, hear the tones, and I just continue to heal.
Be your worst low. There's a very thick low here.
I started this idea nearly 30 years ago, and it's just developed into an entity on its own. Lots of people are doing this stuff now. We've trained about 3,000 practitioners. We even got an article back from a drug company where they're using vocal analysis to predict Parkinson's disease. This works with every other kind of medicine there is. We want to work with anybody who has people's wellness in mind.
She also has done stuff with healing by listening to your voice and taking a voice print of your speech, and she can tell you what your body is missing, your notes are missing, how ill you are. My daughter, who had terminal cancer, who passed in 90, was on morphine with a bag and injection in her side every few seconds to get rid of pain. She visited Sharry, and she found out what tones that she was missing, and we were able to record them and play them back for her, and she threw the morphine bag away. But it did not save her life, but it did take away her pain, and she didn't die a drug addict. It's a phenomenon. I don't say that you should subscribe to it and believe it. It's your option. I'm the person who believes in something. If it works, it's good. If it doesn't work, I'm not going to bother with it.